Hello everyone, my name is Humam. I'm third year medical student at the University of Amin. Today I'm gonna talk about aphasia, which is a language disorder. First, aphasia is the language disorder defect that affects our ability to communicate and understand whether speech, whether it's written or we hear it. It's damage to a certain area of the brain, the language area. The language area in the brain is present 95% in left dominant hemisphere. The two main areas are Broca's area and Wernicke's area and Broca's area. But there are other areas associated with the mechanism of speech, such as the auditory cortex or the visual cortex. First, I'm going to show you a video of a patient's image of a patient that's listening to a sentence, and we'll see the area that gets activated. We notice that the area that gets activated is the superior gyrus of the temporal lobe here. This is the site of the auditory cortex, Bowman area 41 and 42. But we notice also that there's an activation in the posterior aspect of the superior temporal gyrus, which is Bowman area 22. This area known as Wernicke's area. This area is responsible for understanding and comprehension of information, whether it's auditory or visual. Then the information, after being comprehended, it's sent to Broca's area through axons of fiber known as the arcuate fasciculus, which is responsible for conduction of the information and thoughts, because the Wernicke's area is the area of thought formation as well. Conducted to Broca's area, Brodmann's area 44 and 45, also pars opercularis and pars triangularis. Here is the same as I said before. Here are the areas. Also another image for the arcuate fasciculus that conduct the information from Wernicke's area to Broca's area. Also, we should mention the importance of the angular gyrus, which is responsible, first I'm going to start with location, which is in the temporoparietal junction. This area is related to the mechanism of reading because it's responsible for inner monologues and conversion and sounding out thoughts. Here's some more information about Broca's area that's responsible for the motor aspect of speech, such as movement of the mouth and tongues and make the phonation through the larynx. Also responsible for grammar processing, because this area, after receiving the information from Wernicke's area to the arcuate fasciculus, it sends it to the motor cortex, Brodmann's area 4. Here's some information about the Wernicke's area. Its location in the superior temporal gyrus. It's responsible for thought formation and deciding the words we are going to say. Also, the visual input about its relation with the angular gyrus, sounding outwards. Here it's I mentioned also that it's language comprehension and receiving information. Here I'm going to start now with the types of aphasia, which is the main subject here. First, I'm going to start out by Wernicke's aphasia, or also known as receptive aphasia. This aphasia, as we said, Wernicke is responsible for comprehension and understanding of the information. So a damage to this area will affect our ability to understand and comprehend the words we are reading or what someone's telling us. Here's the site of the lesion. What's helped us is this from the USMLE step 1. This graph, which shows that Wernicke's area, you would have, if you have Wernicke's area, you would have a poor comprehension because it's responsible for understanding. But you would be fluent in speech. You would be fluent and as per singing, because the motor aspect of the language is intact and it's not affected. But you would also have a poor repetition, because the repetition mechanism is like this. You receive the information from the auditory cortex, then it's converted to the Wernicke's area, then sends to the fasciculus, then the Broca's area. So if you have lesion there, you wouldn't be able to repeat the sentence. Then we can go to the Broca's area. Broca's area is the motor. So the motor, if you have problem with the innervation or the mechanism of speech, the motor aspect, you wouldn't be fluent, but you would be able to understand information because this area would be intact, which is known as Wernicke's area. Again, you would have a poor repetition because I said the area of repetition is this. Then I'm gonna talk about the conduction aphasia. This aphasia is due to damage in the arcuate fasciculus because it's the area is named because the arcuate fasciculus is responsible for conduction of the information from the Wernicke's to Broca's area. Again, you would have a good comprehension. You would be fluent because these areas are responsible for this information, this kind of function. They would be intact. But the damage would be only here. You would have poor repetition. Now I'm gonna talk about a similar type of aphasia, similar to each type I talked about. First, transcortical motor. As I said, motor, so you know it's near the Broca's area, and it's similar to Broca's area. Here you can read that around the Broca's area. So it's also motor, but it's not the Broca area itself, the Brodmann area 44 and 45. The difference in that the lesion would be here. You would have here, you would have a good comprehension, but you wouldn't be fluent because it's also damage to the motor aspect. But you would be able to repeat the sentence because the area responsible for repeating or related to this function is intact. Same transcortical sensory area, which is here. The damage would be here, not here. So it would be only similar because it's around it. But you would have a poor comprehension because it's similar to sensory receptive. You'd have poor comprehension, fluency because the motor aspect is intact, and good repetition because the lesion is here, not here. Two other types of aphasia I would like to talk about, which were not in the graph, are the anomic aphasia and global aphasia. Global aphasia, I'm going to start with it because it's the most severe. It's due to a damage in Broca's and Wernicke's area. When you are not able to comprehend the information or speak fluently. The anomic aphasia is due to a damage in any part in the cortex or subcortical in the dominant hemisphere. It's mostly the adequate fasciculus. When you are not able to say a certain word, you would be like you can speak a full sentence, but you wouldn't be able to say the very certain words. It's like here he's trying to say apple. Another classification of aphasia is fluent and non-fluent aphasia because we talked about the motor and non-motor. Here we see that the damage in this area is in the dominant hemisphere, but it's not appear what area exactly, so it's anomic. Again, this is just a mnemonic. It's not scientific. Here we see the area. Here is the posterior aspect of the superior temporal gyrus. We notice that this area is Wernicke's area. So it's Wernicke's aphasia. These are the symptoms and some characteristics of each aphasia. Here is parts between the Broca's area, which is this, and Wernicke's area here. The area that's conducted between them is the arcuate fasciculus, so it's conduction aphasia. Again, also this information about this type of aphasia. Here, the area surrounds the Wernicke's aphasia. This area, not the Wernicke's area itself, but surround it. So you know it's transcortical sensory area. Non-fluent aphasia, it's the motor aspect. So we know this is the Broca's area, as we said. So Broca's aphasia. Here we have, I don't know why I start three. Here is the mixed, which I forgot to explain, is when the two areas surround the Broca's and Wernicke's is damaged, which is not very common, where you have poor comprehension, and poor fluency. Also called isolation aphasia. Here, the area surrounds the Broca's area, so we know it's transcortical motor. In the left dominant hemisphere in general. So it would be a global aphasia. Here, it's just schemic to remember to simple diagnostic. It's not really that's important because the detection of this is by radio imaging or speech language pathologist, which is responsible for this type of treatment and also on diagnosis. Here to make it easy, is the patient fluent? No. Is he able to comprehend the information that you are saying to them? No. Can he repeat or have a good repetition ability? No. So it's global aphasia. If yes, it's mixed transcortical aphasia. Here's example for each area. Wernicke's aphasia, you wouldn't be able to form thoughts, not only understand, but you have difficulty formation of thoughts that sense to Broca's area. And you can see Broca's area, you would have difficulty initiation of speech and speaking non-fluently. Here you would have also problem initiation of speech due to damage in the connection between the supplementary motor cortex and the Broca's area. Cause of aphasia. The main cause of aphasia is stroke to the middle cerebral artery. As Mustafa said, the middle cerebral artery is responsible for the blood supply of the lateral side of the brain. So each site of injury will result in a different type of aphasia or different type of site of injury. But also we shouldn't forget that there are other causes such as brain tumor, infection, and also Alzheimer or dementia or head injury. But there's nothing. That doesn't mean you wouldn't be able. A patient with aphasia wouldn't be able to communicate or speak with others. Due to development of size, we can communicate with them in better level, and also speech language therapy would be very helpful. Nonverbal communication and technology would be helpful, such as group therapy. Here I'm gonna a very simple case. We're gonna talk about first 72-year-old man coming to the emergency department. That can speak well, articulate questions. So we know his Broca's is intact, but lack meaning. Upon further examination, he would have difficulty repeating. As you said, the difficulty repeating is very important, and does not appear to understand the question he's being asked. So we know he'd have what areas are damaged. So we know he has difficulty in understanding a sentence and repeating, but he is fluent in speech. Does anybody want to solve this case? It's very easy. Please raise your hand if you are interested. Yes.
الو يشغل المايك.
السلام عليكم.
السلام عليكم السلام. اول شيء عنده هذا مشكله بويرنك، يعني ما يقدر يفهم الاسئله.
حسين
صحيح.
بس الصوت زين.
In English please.
نعم. The patient has a damage in his Wernicke area because he doesn't seem to understand the question being asked, and also his articular fasciculus because he can't repeat phrases.
Well, it's damage to you are right. It's damage to Wernicke's area, as we can see in the posterior aspect of the superior temporal gyrus in the left dominant hemisphere. But the ability of repetition also due to a damage in Wernicke's or the articular fasciculus or Broca's area. Excellent. Thank you so much. Here are some of the references that I use I found this the most useful because it's teach the mechanism of language, not the aphasia. I didn't talk about aphasia, but it was most helpful because it helped me understand what's the area related to repetition. Why is repetition different than comprehension? Because because the brain is able to repeat sentences even without comprehending them. Because some of them might remember from school, sometimes the teacher tells you, what did I say? Even if you are not paying attention, you might be able to repeat what it said because it's responsible for the short-term memory and its relation to Wernicke's aphasia. But if you were to comprehend this information, you would have to go to the anterior temporal lobe I'm sorry, I forgot the word in English, but معجم اللغة it's in the anterior temporal lobe, so it's essential to comprehension. But if you were just to repeat the sentence, you would be only to Wernicke's, the fasciculus, or superior longitudinal fasciculus and Broca's area. Thank you for your attention.